With the patient supine, hold the patient's upper extremity at 90 degrees to the trunk, internally rotating the glenohumeral joint, which effectively locks it. With your index and middle finger, extend the patient's wrist and hold while supporting the patient's upper extremity against the osteopathic belly. This will lock out the patient's elbow. Using a clawed hand, the index finger should cover the acromio-clavicular joint, whilst the sulcus between thenar and hypothenar eminence rests on the patient's clavicle. Now, let us look at anterior-posterior palpation of the acromio-clavicular joint. With the glenohumeral joint locked, pull the humerus anteriorly. As you do this, you will feel the clavicle rising under the heel of your hand. Gently resist this movement, thereby focusing more movement at the acromio-clavicular joint, which you should be able to palpate using the index and middle fingers of the clawed hand. With the posterior shift, drive the humerus posteriorly. The acromio-clavicular joint separates as the scapula moves away from the clavicle. Again, you should be able to palpate using the index and middle fingers of the clawed hand. For superior-inferior palpation, bring the patient's upper extremity into slight abduction. Again, internally rotate the glenohumeral joint with your point of application just above the patient's elbow. Drive the humerus in a superior movement whilst palpating the acromio-clavicular joint with your clawed hand. For inferior movement, pull the upper extremity towards you.